What is Niromathe? Niromathe is a vertebral and peripheral reflexotherapy. It is based on a technique which was brought back to France from India by a Catholic nun, Sister Chabrit. It is also based on the work of natural healers from the north of France. Together, Thierry Van Dorm, an osteopath in Paris, and Dr. Raymond Branley made an amazing amalgam of these manual therapies. Niromathe is the result of 25 years of research and observation of the move that heals. During the Niromathe treatment, we are going to observe three key concepts. The first concept is to unloosen the skin at some specific areas of blockage, with a precise gesture that we call the Niromathe move. It is as if the blocking, the seizing up of the joint, was not at the level of the joint itself, nor even at the level of the muscles, but is the result of cutaneous snagging at the level of what we call the tensomodulator elements between the skin and the underlying structure. These areas become clumpy, sticky, bringing about lymphatic congestion, preventing free movement in the tissues. Take the example of a young patient presenting with a hyperalgesic stiff neck. The neck cannot turn to the right because the skin cannot be stretched towards the right. A detailed analysis of the skin allows the practitioner to locate points of adhesion. A delicate stimulation of the skin allows an instantaneous release. At the same time, the cervical spine becomes painless and flexible again. The second concept is polarity. Polarity is largely observed in fascial techniques. The therapist keeps both hands on the patient. There is an effector hand and a receiving hand. The third concept is the cartography of the points. An evaluation of the type of blockage will allow the therapist, using the Niromathe method, to make a precise move and use specific mapping of the key points. These points are located on osseous asperities. This mapping differs according to the pathology. What are the advantages of a Niromathe treatment? Niromathe is fast and easy to perform. One session can last from 10 to 15 minutes, rarely more than 30 minutes. It is gentle, painless, and practical. All you need are 2 stools and the practitioner's hands. That's all. The patient can remain dressed, and the session can be interrupted momentarily. Niromathe addresses all osteopathic lesions, acute and chronic osteoarticular congestion, cervicalgia, torticollis, dorsalgia, lumbalgia, lumbago, migraines, sinusitis, facial pain, tendinitis from any localization, neuralgia, facial, cranial, cervicobrachial, thoracic, abdominal, sacral, crural, sciatica, periarthritis, capsulitis, bursitis, inflammatory calcifications, sprains, also acute and chronic visceral congestion from mechanical origin, and also many functional disorders such as tinnitus, strabism, stuttering, fibromyalgia, anxiety, and stress.